This short video discusses driver diagrams in healthcare quality improvement, or QI. A driver diagram is a simple visual tool used in QI to help us think systematically about multiple aspects of the process. Let's begin by diving into an example of a driver diagram to understand its parts. This driver diagram is from a QI project to enhance health literacy. Health literacy is defined as the degree to which patients have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. We will dissect each component of this diagram in more detail a little bit later in this video. For now, notice that a driver diagram can have 3 or more levels. From the left to the right, a goal for improvement, high-level factors needed to achieve this goal, called primary drivers, and specific activities that result in these factors, or secondary drivers. As you see here, each of the primary drivers is broken down into 2 or 3 secondary drivers. At each level, the driver diagram ends with change ideas or actions. At a glance, you can see what this improvement team decided were important factors, as well as actions that they planned. So when do you use this important improvement tool? Driver diagrams are well suited to complex goals, where it is crucial for a team to explore many factors and to undertake many actions. They help improvement teams identify factors with the biggest impact and help set priorities. They enable teams to show how various factors are connected and to organize information. And they promote communication, conversation, and agreement on the change strategy and how work should be done. Whenever possible, drivers in a driver diagram should be measurable. This way, the diagram also becomes a framework for tracking progress toward a goal. So as you see, driver diagrams serve the important purpose of providing a theory of change for your QI initiative. Before starting to create a driver diagram, it is important to be clear about the improvement team's goal. In this example, to improve health literacy. Primary drivers are 2 or 3 key high-level elements that directly contribute toward the goal. Ask yourself the question, if we made an improvement in this driver, what would it achieve? Would it move us closer to our goal? If we did all these things, could anything else stop us from achieving our goal? If so, we might have missed a primary driver. In this example, our primary drivers are excellent verbal and visual communication between clinicians and patients. Secondary drivers are linked to projects and activities and contribute to primary drivers. They may differ in their relative impact on the goal. To help identify secondary drivers, ask the question, what things in the system will help my team achieve this primary driver? In this example, our secondary drivers are avoiding the use of medical terminology or jargon, checking to find out if patients understood the information we just gave them, providing easy-to-read written materials, using images, graphics, and models to demonstrate key points, and providing patients with materials that clearly indicate key actions. Secondary drivers are then used to create change ideas, projects, and actions that will affect primary drivers and move you toward your goal. In our example, some change ideas are for clinicians to use everyday plain language, speak a little bit slower when communicating key information, repeat key points, ask patients how they will follow instructions at home, a concept known as teach back. Test materials that are used with patients to see if they are at least at a 5th grade reading level. Highlight, circle, or read aloud key points in educational materials used with patients. Another change idea is that the educational material provided clearly identifies at least one action that the patient needs to take. So now that you are convinced that using a driver diagram in your QI initiative is a fabulous idea, How do you go about putting one together? First, start by clarifying your team's goal for improvement. Then gather subject matter experts and stakeholders. Try and get together a diverse group of people to make sure that you don't miss any critical perspectives. Anyone who is touched by the process you are working on improving is a potential person to include in this group. Then brainstorm. The group asks the question, to achieve our goal, what are the things we need to improve? Then cluster similar ideas to see if your team can find groups of ideas that represent common drivers. Next, expand the groups or ideas by opening up the discussion again and see if any new drivers come to mind. We are now ready to logically link the groups in a driver diagram format. Some teams may choose to use arrows to highlight cause and effect relationships. During this linking process, you may identify that a secondary driver may affect more than one primary driver. If it helps, work backwards from project ideas. Then set priorities for change ideas, actions, and interventions. Ask the question, how can we most influence our goal? Finally, we can begin to identify relevant appropriate measures for each driver that help us track progress toward our goal and helps the improvement team and other stakeholders stay interested and motivated in this work. Once we have completed a driver diagram, we are ready to begin developing project plans and implementing changes. To summarize, driver diagrams are best used when an improvement team needs to come together to determine the range of actions they have to take to get to a goal. They work best when we involve others in developing them. Driver diagrams help us identify essential factors, prioritize improvement efforts, define meaningful measures, break down a big task into manageable steps, and communicate our goal and rationale. It is important to remember that there is no right or wrong driver diagram. These diagrams just represent a team's mental model of a situation, and it is quite possible that this might not be shared by others. The driver diagram is, however, an important tool for communicating this mental model to others.